Hello, good afternoon. My name is Dr. Chudi Ufondu, and it's another opportunity to talk about a medical problem that might be affecting some members of our community. So, thank you and welcome to Open Clinic with Dr. Chudi on YouTube. Please, once you come in, confirm you can see me, confirm you can hear me, and I'm going to start. Today, we're going to look at breast milk discharge from a perspective of normality and what happens in regards to breastfeeding and your fertility. So please quickly announce your name, announce your location. Then as soon as I have a signal, I'm going to start. Dr. Ndiche, thank you for coming. So today we're going to talk about breast milk discharge from a non-pregnant woman, the role of breast milk in pregnancy, and the role of breast milk when you are done having your baby, and how soon your fertility can come back. So many people are on this page. So it's an important topic. So if you're currently not pregnant and you notice that milk or fluid is coming out from your breast, it's not normal. We need to investigate. We need to know what's going on so we can help you. It's actually one of the conditions that can delay your ability to become pregnant. So when we talk about breast milk, we are talking about the normal breast milk production and the abnormal breast milk production, how it can affect your fertility, how it can enhance your fertility. So if you're currently experiencing discharge of breast milk and you are not pregnant, that condition is called galactorrhea. Galactorrhea. Now, majority of that condition is caused by increase in the level of an important hormone called prolactin. So you see, there are a couple of important reproductive hormones that will help a woman to become pregnant, stay pregnant, make sure her baby is good until she can become pregnant again. So there are key important hormones: estrogen, progesterone, FSH, LH, and prolactin. Now, in a non-pregnant woman, if for some reasons her prolactin level is high, when your prolactin level is high, how do we know? We collect your blood, then we check the level of prolactin. If that condition is there, it's called hyperprolactinemia. So I want you to focus on two concepts: galactorrhea and hyperprolactinemia. Some women that have higher level of prolactin will present with breast milk discharge. So breast milk discharge is galactorrhea. High prolactin is called hyperprolactinemia. Now, both of them can delay a woman from becoming pregnant. The only time we expect something to come out from your breast is when you're pregnant or when you're breastfeeding. Besides those two conditions, you are not supposed to have breast milk coming out from your breast. When you have that, it's an independent infertility factor. Thankfully, we can fix it. So if you are currently not pregnant and you notice by yourself that when you press your breast, something comes out of it, it's possible that might be the problem you're having. Now, thankfully, we have a specific drug we can give you that can take care of this. Now, please, don't go taking this drug by yourself. If you notice that breast milk is coming out from your breast and you're not pregnant, please book an appointment. Go to your gynecologist. We are going to ask you a lot of questions. There are some conditions that can also lead to that. Stress can cause it. Some drugs can cause it. Some hormonal issues can cause it. Problems in the thyroid gland can cause it. Problems in the pituitary gland can cause it. So it's not only isolated prolactin condition. Some women might also have high prolactin level and they will not have breast milk discharge. Some women will have normal prolactin level and they are discharging. It's the duty of the doctor to investigate to see what is actually leading to that. But generally, across the board, if you are not pregnant and you notice that breast milk is coming out from your breast, that's an abnormality. We need to fix it. The earlier we fix it, the better, especially if you want to be a mother. If we don't fix it, it's going to affect the function of other important hormones. So for women that have this condition, possibility remains they might not ovulate. So there are some hormones that will help you to ovulate. Your FSH, follicular stimulating hormone, your estrogen, your LH. Now, when your prolactin level is high, it will disrupt the normal range of all these hormones I mentioned, and unfortunately, you will not ovulate. And when you don't ovulate, you cannot become pregnant. But if we fix your prolactin level to be within the normal range, your estrogen level will function properly, your progesterone will function properly, your FSH will function properly, your LH will function properly, and you can ovulate. So thankfully, it's a condition we can fix. There are specific drugs we can give you. Now, if you were given these drugs and for some reasons the breast milk discharge continued, please follow up with your doctor. Don't increase, don't stop, and don't do it by yourself. Make out time and go and see the doctor. The doctor is the right person that will tell you what to do. Very, very important. Now, if you are pregnant, it's expected that there will be changes in your breast. Part of those changes, number one, it will be what? You will notice an increase in the size of your breast. You will notice that your breast will be tender. So tenderness means if we touch your breast, you will feel heaviness and pain. It's expected. Your breast is getting ready to breastfeed your baby. So there are channels, there are ducts inside your breast through which milk will flow so that when your baby suckles on your breast, milk will come out. As a woman, when you're getting ready for your baby, your breast will begin to accumulate milk and it will be big. Now, when you give birth to your baby, depending on the type of method of feeding you will adopt, it can affect the ability of your fertility to come back or not to come back. I will give you an example. If your method of feeding is strictly breastfeeding, that means you're giving your baby only breast milk for at least 6 months. You will not have a return of your period for most women. So women that go on exclusive breastfeeding will notice that their period will take longer to return. But if you combine your breastfeeding with infant formula, you will notice that your period will return early. Now, the return of your period is actually not the criteria to know when to begin to avoid pregnancy. Some women can easily have return of their period as early as 6 weeks. So if you meet with your partner as early as 6 weeks, you can ovulate and you can become pregnant. So whether you're bleeding or not, that's not the criteria you should be on the lookout for. And even if you're doing exclusive breastfeeding, look for other reliable contraceptives. Remember, once you have given birth to a baby, we advise you to wait for 18 months. 18 months is the cutoff point. Please don't quickly want to become pregnant when your baby is still little. You are putting pressure on that baby, you're putting pressure on yourself, and you're putting pressure on the new baby you will have. So allow 18 months. So it's expected that every new mother will breastfeed the baby. Now, when you don't breastfeed your baby, there will be accumulation of breast milk in your breast, and it's very, very, very painful. The reason is because whether you like it or not, your brain will keep telling you to produce milk. This is nature. So once you are pregnant, once you have delivered, your brain will give signal to the prolactin to keep on producing milk. So whether you like it or not, you have to express your breast milk. When you don't express it, it's very, very painful. Now, we have some professional women who might not be feeding their baby around the clock. What do? You express that breast milk and you keep it in a safe place. But by any means possible, you have to constantly empty your breast, because when you do that, fresh milk will come forth. So one of the criteria you need to bear in mind, if you are not pregnant and you notice that breast milk is coming out from your breast, that's a problem. We need to fix it. It's a cause of infertility. That condition is called galactorrhea, And the reason that might lead to it is what? Hyperprolactinemia. We can give you drugs. So if you are not pregnant and you're in this gathering and you notice this, it's not normal. Now, if you are pregnant and you notice your breast is leaking, it's completely okay. If you are breastfeeding, expected. The only time I want us to worry about this is when we are not pregnant. And please don't go taking bromocriptine and other medications by yourself. Run it by your gynecologist. We have to take your blood sample and look at the prolactin level. Now, if we have given you the drugs for treating hyperprolactinemia and you finish taking them and you notice that you are no longer having breast milk discharge, don't stop there. Go back. We need to take another blood sample and make sure that your prolactin level is okay now. So don't take matters into your hands. Form the habit of touching base with your doctor so your doctor will guide you appropriately. So these are the facts. These are the mechanisms you need to be conversant with regarding your breast and your breast milk, okay? So now when you're pregnant, whether you're doing exclusive, whether you're not doing exclusive, the more exclusive you do, the more your period will be delayed. So if you give your baby only breast milk for 6 months, the possibility that you won't even see your period for 1 year is there. Now, if you're combining breast milk with formula, the possibility your period will come back as soon as 3 months is high. Now, it's not constant. Women respond differently. So if you are a new mother, whether your period is back, whether your period is not back, you can become pregnant. So stop using the criteria of your period to come back before you start avoiding making love with your partner. If you make love with your partner as a new mother, you can become pregnant as early as 2 months because many women will ovulate before they bleed. Keep this in mind. One of the important conversations you have to have with your doctor before they send you home is contraceptives. So don't depend on withdrawal method. Don't depend on cyclical method because your period is all over the place. Don't depend on what we call lactational amenorrhea. So lactational amenorrhea means when you're breastfeeding your baby, prolactin level will be high, and when prolactin level is high, it will block the other hormones. But it doesn't work that way. It's a passive contraceptives. It can fail, just like your withdrawal method can fail. This is very, very important. Please, all pregnancies must be planned. All babies must be cared for. You don't gain anything having a baby and you're pregnant again within 3 months. That's completely selfish. So at this point in your life, you have to plan for all babies. You have to make provisions for them physically. You have to make provisions for them emotionally. You have to make provisions for them physically, financially, psychologically. You have to be there for your baby. It's important. Don't go competing with people. Don't go being in a hurry. There are some women we can give some modifications. So if you are above 40, we might not necessarily wait for 18 months because by the time we come back for 18 months, you might not have that opportunity to have a baby again. So, but if you are younger, we always advise you to go for 18 months. 18 months is when you will begin to try, not when you have your baby. Okay? All right. Okay, thank you guys. The clinic is open now. I'm going to take a couple of your questions. So please go ahead and start asking your questions. So once you come in, the floor is open. Remember, we were talking about breast milk discharge in a non-pregnant lady and breast milk production in a pregnant woman and in a breastfeeding woman. So the clinic is open. Now is the time for you to ask your questions in real time. This is a topic you need to take very serious. So if you are currently pregnant and your breast is leaking, completely okay. If you are currently breastfeeding, completely okay. If you are not pregnant and you have this problem, it's part of the reason why you are not a mother yet. Okay? So please go ahead and ask your questions. Admin, feel free. Dr. Ndiche, you can ask questions and we can have a back and forth discussion on this. I'm not seeing any question yet. So please start asking your questions. Start asking your questions, please. Kenneth, I'm sure you've been asking questions and maybe YouTube, for some reason, it's not allowing some questions to come forth. We've been having this problem. When is nipple discharge a concern? Like I mentioned, if you are not pregnant, When you have nipple discharge, when you are not pregnant, when you are not breastfeeding, that condition is called galactorrhea. Galactorrhea, that's when it's a concern. So it's part of the problem that might be delaying your ability to become a mother. So if you are currently not pregnant and you notice, matter of fact, let me give you an assignment. Most times it's the male partners that will notice this. But when we are done with this clinic, I want you to go and take a good look at your breast. So many women are not breast friendly. What do I mean by breast friendly? You don't even examine your breast. You don't observe the differences. You don't know how to do your breast self-examination. So what I will tell you to do today, let it be one of the things you've learned from me in 2021. When we are done, go to a big mirror. Strip yourself of all articles of clothing completely. You're going to be naked. Okay? Now, look yourself up in the mirror. Observe, power of observation. Observe the two breasts. If you pay attention, you will notice that one breast might be fuller, might be longer than the other. Completely okay. You don't need to worry about it. Now you put your two hands by your waist so you can kind of contract the breast a little bit. Then you pay attention again. When you are done that, see your breast like a clock. Divide it into 4 quadrants. 12 o'clock, 6 o'clock, 9 o'clock, 3 o'clock. Then use the soft pad of your hand to touch softly. You should be conversant with the normal feel of your breast. If you don't know this, you won't know when you have a lump. So I want everybody to do this. Unfortunately, some people have so many misconceptions about their body. Nobody can look after your body better than you. Coincidentally, most women that have galactorrhea is actually an incidental finding from their partners. Some men love to play with the breast. So if your partner is making love to you and suddenly breast milk is coming out, that's not the time for him to start feeding on breast milk. The only person that should be feeding on the breast milk is who? The baby. So if you are not pregnant and your partner loves to play with your breast and your partner discovers that breast milk is coming there, he should not consume it. That's not healthy, okay? So be breast friendly. And when you're done doing that, take time and examine your whole body. Examine your vulva. Examine every single thing about you. Nobody can do this better than you. Make this a point of habit. You have to know how to examine your breast by yourself. Very, very important for all women. Okay. All right. Does breast discharge lead to or cause cancer? No matter. Now, milky breast discharge, it's mainly due to high level of prolactin, which we can fix. Now, some women can also have some inflammatory conditions in the breast. Some women can have pain. Now, when we begin to have concern in regards to breast discharge, if when we notice a coexisting lump in the breast, which might be a sign of cancer, unfortunately, some breast cancers are very silent. They will be there, but you wouldn't even know, and they will be causing havoc. Now, the only concern we have in regards to breast cancer is when the breast discharge is blood tinged. So if you have bloody nipple discharge and you have pain in your breast and you have obvious mass in your breast, possibility you have cancer is high. Now, cancer is not something you just assume you have. So you can still have all this and it might not be cancer. The commonest condition in the breast is not cancer. It's what we call adenoma. So most women will have this a benign condition. So anytime you have a growth in the body, it's either it's cancer or it's benign. So benign means it's not cancer. So majority of women that will have lump in their breast, it wouldn't even be cancer. It might be changes. It might be a couple of things going on in your breast. But if you don't know the normal, you wouldn't know the abnormal. So the only time we begin to worry about cancer is when we notice visible difference in the breast. And the only way for us to confirm you have cancer is to see a doctor. Probably we'll send you for mammogram. We run a couple of other tests before we can confirm and say this lady has breast cancer. Now, breast cancer can be prevented. Breast cancer can also be treated depending on the time of diagnosis. So time is the biggest friend and the worst enemy for anybody out there. If we discover breast cancer on time, we can go for radical treatment. So we can give you chemotherapy, we can give you radiotherapy, and we can go for surgery. If need be, we can remove the whole breast. But if by the time we are noticing you have breast cancer, is already late, it can spread through the other breast and it can spread to all the parts of your body. That condition is called metastasis. We don't want any cancers to spread. We want to cut that cancer on time and begin to go aggressive on cancer. Okay, so don't worry. Some women, once they have breast pain, they go to Google, oh, breast pain. If you type in breast pain right now in Google, the first thing they will bring out is what? Breast cancer. Then you begin to feel you have cancer. And before you know it, you've already given yourself a diagnosis you don't have. Okay, let's continue. All right. Is it possible to have normal prolactin level and still have nipple discharge? Yes, Major?
Why didn't you give me my donuts?
Yeah, okay, we'll do that when I'm done, okay?
Okay.
Yeah, my young man is querying me for donuts. Sorry about that, guys. So yes, sometimes you will have normal prolactin level, okay, and you're still having galactorrhea. This is why I mentioned that it's not only high prolactin that can lead to galactorrhea. Some drugs can cause it, stress can cause it, some thyroid problems can cause it, some inflammatory process in the body can cause it. So it's not only hyperprolactinemia that can lead to increase or galactorrhea. So this is why we need to check your body. Some women might have normal level of prolactin, but they are still discharging. When that happens, we need to investigate. We need to think outside the box. So it can happen. It's not only high prolactin that will lead to breast milk discharge. If other conditions are there and we discover that, we can fix it. Let's continue, guys. Thank you. For women who can breastfeed after giving birth, what's the cause? Now, there are a couple of psychological factors, stress, and in rare cases, some inflammatory process. Some women can have blocked ducts. So it's not unusual for a new mother to have problems with milk let down. So if you're stressed, if you have a couple of psychological issues, if you don't have good support, your milk production system can actually cease. Now, thankfully, we have lactational specialists that can help you navigate through this. Now, there is something that people practice that is not good. I know in Africa, in Nigeria, your parents have told you, oh, drink palm wine to produce your breast milk when you're a new mother. That's alcohol. You are not supposed to consume alcohol. I know this is a common practice. It's possible you've been trying it. It's possible it's been working for you, but it's alcohol. Your palm wine contains alcohol. You don't need alcohol before pregnancy. You don't need alcohol during pregnancy, and you don't definitely need alcohol when you're breastfeeding your baby. When you're taking alcohol and you're breastfeeding your baby, indirectly you're giving your baby alcohol. So you don't do that. What you need to do is to work on your stress level, increase your fluid intake, make sure you're sleeping. Then talk to a lactational specialist. Some women might need breast pump. Your breast milk is something that God gave you naturally to feed your baby. So if you're having problems, talk to a lactational specialist and they can help you figure things out. Okay? Thank you, Doc. For women who can, okay, I've already answered that. Can men have high prolactin? You see, I tell you guys, I have a body of doctors as admin. Now, yes, remember that for every hormone a woman can have, a man can also have it. So men have estrogen, men have FSH, men have LH, men have all the hormones. Now, the problem is the level you should have it. So the level of estrogen in men and women are not the same. So when a man has a high level of estrogen, that is actually part of the pathways that can lead to problems. So the same vein, men can also have breast cancer. Okay? So yes, men can have increase in prolactin. Now, increase in prolactin in men might be related to drug use, a couple of drug abuse and a couple of lifestyle issues, and sometimes they might have hormonal issues. So it's rare, but men can also have hyperprolactinemia. And when that happens, we can also give them the same drug. We can give women that have hyperprolactinemia. So whatever a woman is going through, a man can go through that. When we talk about hormone imbalance simply means your estrogen is supposed to be 10%, but it's 5% or it's 20%. So once your hormone is outside a particular range, that condition is termed hormone imbalance because it's not within the normal range we want it to be. So breast discharge in males might be rare, but it can happen. Now, men can also have breast cancer. Men can also have lumps. The commoner thing that might happen in men, if the level of your estrogen is high, is what we call gynecomastia. So ordinarily, men are not supposed to grow breast. So anytime you notice a normal male, then suddenly his breast is developing like a female, that's a problem. It's called gynecomastia. He needs to seek medical help. The possibility that that man might not be able to father a child is very high. So if your partner is in this clinic today and his breast is growing big and he's noticing low libido and you guys still have infertility, we need to investigate your partner. When we check your partner closely, it's possible that the testosterone might be low. It's possible the sperm might be low. So we need to take everything serious. Now, when you're adding excessive body weight, the possibility that all parts of your body will start growing big is very high. So men that will notice increase in their body weight will also notice increase in possibility of having gynecomastia. Gynecomastia is the development of breast in males. Males are not supposed to develop breast. So it's an abnormal condition. So if your partner has this, encourage him to see a doctor immediately. Okay? All right. Women that can't breastfeed after birth, psychological problem, emotional problem, some hormonal problems, lack of care, talk to a lactational specialist and you can get help. And don't stop. Not every woman will notice increase in their breast milk immediately after childbirth. If you're a mother, you will notice that when the first baby started suckling is not when the second baby started suckling. The more relaxed you are, the more helping hand you have, the more good sleep you're getting, the better the flow of your breast milk. So don't stop. Practice makes perfect. So keep on putting the baby on the breast milk. By default, the first thing your baby will do when they newly deliver your baby and they put your baby on your chest, where do you think your baby will go to? Your breast. You and your baby, you already have a bond naturally. So don't worry about it. Focus on doing your own best and your breast milk will definitely come forth. Okay? All right. Do we have any other question? I have 4 minutes. If you still have questions, please still keep asking your questions. Share this video with anybody that might be of interest in knowing more about galactoria. Now, if today is the first day of attending our clinic, we do this every Saturday. We actually supposed to have done this by 6 p.m. Nigerian time, but we had a couple of things coming up, so we have to delay it to 7:30. But every Saturday by 6 p.m. Nigerian time, 12 p.m. Eastern Time US, you will see me talking about a topic of great interest for 30 minutes. Now, on Tuesdays, you're going to see me again. So we run our clinic in YouTube twice. Tuesdays, 7 p.m. Eastern Time, 1 a.m. Nigerian time. Saturdays, 12 p.m. Eastern Time, 6 p.m. Nigerian time. Now, make sure you click on the notification button so that even if you didn't attend this live, you can always get a notification to go back and review. Now, please, whatever happens, keep on practicing your PPP. Keep on praying, keep on playing 48 hourly, then keep on practicing. If you can adopt your P, praying, playing, and practicing, you will be a mother in 2022. Now, tomorrow is a big day in our group, a day you don't want to miss. Now, I know you have your plans for Christmas. I know some of you might have been trying or giving up. Guess what? You can still become pregnant in December. So please, if you haven't registered for that Super Masterclass, the reason why it's Super Masterclass is because we are combining IVF and multiple pregnancy. So make sure you register for that.
I bumped my head on the couch.
Sorry, I will tell you now. So if you haven't registered for the multiple pregnancy and IVF masterclass, I encourage you to do that today. Today is the deadline, okay? Make sure when you come expecting. There are so many twin mothers, there are so many triplet mothers, there are so many quadruplet mothers in this community. Now, on the 31st of this month, we have a crossover clinic. That crossover clinic is going to be a celebratory clinic. So you're going to come with your positive pregnancy test. You're going to come with your baby girls. You're going to come with your baby boys. And we're going to have fun. We're going to give God the glory because God has been with this group. The group you saw today is based on God. So thank you for coming this afternoon. And don't you ever give up. Whatever happens, keep on praying, keep on believing, keep on practicing, keep on playing, and God will attend our prayers. I'll see you guys. Now, if you're in our group in Facebook, please transition to our group because I'm going to our group to spend 30 minutes to rally around before tomorrow. Until I see you, God bless you and enjoy the rest of your weekend. Bye-bye for now. God bless.